smoking and drinking can lead to more than just a hangover. The two can also lead to the development of throat cancer, which can be deadly if not directed or rather detected early on. Now, to tell us more about this, we are joined here in the studio by Dr. Dan Alonzo, the Consultant Director of the Cancer Center at the Medical City. Good morning, Doc.
Good morning.
Good morning. Very much in the news at the moment, of course, is throat cancers, or specifically nasopharyngeal cancer. Unfortunately, the husband of Camille Prats succumbed to it. We, of course, commiserate with their family. But very much in the news. I mean, it's something that we should be aware of. I suppose we should be starting with the general terms here. The general classification of throat cancer and specifically nasopharyngeal cancer. Can you differentiate, one from the other?
Well, the throat is a long tube from the back of the nose all the way down to the throat, down to the entrance of the esophagus.
Okay.
So the nasopharynx is a specific part of the throat that is behind the nose.
Okay. All right. So that's a more specific type of a specific area where the cancer has developed, but it falls under the general classification of a throat cancer. Okay. Throat cancer is something that we should be, very concerned about because it's actually very common. I believe it's something that develops quite commonly. For people, usually, more often than not, who have lifestyle practices which lead to this. I mean, in the intro, we said smoking and drinking, and you said the combination of the two makes it even more a higher risk of developing these types of cancers. Throat cancers, very common, aren't they?
Yeah, it has been proven that when you smoke and you drink, it has these two are, when you combine the two, they have synergistic effect.
Okay.
So it's not 1 + 1 = 2. No, it's 1 + 1. It can be 100 times.
Right. You multiply the effect.
But for nasopharyngeal cancer, yes, smoking may be a factor, but there are other causative factors.
Okay. Well, for people who might be suddenly worried about this condition, what should they really be watching out for in terms of symptoms specific to the development of throat cancers?
Specifically, nasopharyngeal cancer.
Well, throat cancers in general, I
because
suppose.
That's why we have to subdivide the throat because of the symptoms and the behavior of the disease.
Okay, well, let's start with nasopharyngeal, I suppose.
Nasopharyngeal cancer. Let's talk about the very early symptoms. Number one, patients may have some ringing in the ear.
Okay.
Some hearing loss or fullness.
Okay.
Nose bleeding is a very early manifestation, and sometimes a lump in the neck.
Okay. All right. For a more general sort of throat cancer symptoms, typically people develop some sort of a cough, I suppose, or difficulty in swallowing from the obstruction of growths. Is this what happens?
Difficulty swallowing is quite a late manifestation. Sometimes just the feeling of a lump in the throat, something stuck in the throat, or maybe pain in the throat, or spitting out of blood. Okay, that's going to be a problem. Sudden loss of weight is always associated with cancers, I suppose. It's a late manifestation.
And neck pains, I suppose, unexplained sort of
neck mass, not pain. Generally, the mass related to cancer is not painful.
Okay. All right. Now, well, going back to the cause, I suppose. What is it specifically about tobacco and alcohol that makes it such a deadly combination? They're both carcinogens, yes?
Yes.
Okay.
When we say carcinogens, these are substances that actually destroy the normal cells at the DNA level.
Okay.
When they destroy the normal cells at the DNA level, the cells actually multiply rapidly. There is no control anymore. Because normally, our cells die at a certain point. Okay. There is no death for these cells, and they multiply rapidly.
All right. Not to say that just because you don't smoke or drink, you're not, at risk of developing this. You did say that data shows that the development of these cancers actually are far more common in men of Asian descent.
Nasopharyngeal cancer, it's common among Chinese, especially the southern part of China.
All right.
Asians in general, And worldwide, nasopharyngeal cancer is like number 23.
Okay.
But in Hong Kong, it's number 4.
Okay, it's very high. All right, so assuming you may have some of these symptoms, you may be worried, you may have some lifestyle issues that you need to change, you're worried that you may have this condition, what should you do? Are there tests that you can have? Are there specialists you should be seeing to help you determine if you have developed a condition like this? What are the steps you should be taking if you feel like you may have some of these symptoms?
Yeah, it's very important for our listeners to know that this is not as bad as what we think.
Okay.
We can say...
Generally, when you say cancer,
there's no more hope. No, no, we just have to detect the disease early.
Okay.
That's why we have to emphasize the early signs and symptoms. Nose bleeding, ringing in the ear, hearing loss or fullness, a lump in the neck. And we have a number of things that we can do to test.
Okay. What are some of these tests that you're
talking about?
Number
one, we take a look at the nose.
Okay.
You just have to see a doctor. We take a look at the nose. We have the technology now, the fiber optic technology. We look at the nose, we see the mass, and we take a sample, biopsy, and that's it. That's the key.
Okay. All right. So assuming you've detected the cancer, what can people, what sort of treatments are out there for people?
You know, again, we have to detect the disease very early, because if we see patients at the early stage of the disease, like stage 1 or 2, this can be curable.
Okay. It's actually a very high percentage. I believe throat cancers can be cured in 90% of patients. Okay, so that's a very high. Assuming you detected it early. So what sort of treatments are there? I mean, you remove the mass. You know, traditional treatments that you generally associate with cancers. What is this, chemotherapy and that sort of thing? Is that related treatment to this type of cancer?
Yeah, for nasopharyngeal cancer, the mainstay in the treatment is radiation therapy.
Okay.
That's number one. When it's bigger, or when it has spread to the neck, that means the stage is higher.
Okay.
We combine it with chemotherapy.
Okay. But you also see more extreme cases where you know, you need to remove masses, and you need to remove certain parts of, well, the throat. I believe you know, we've seen those people who are speaking through some sort of a device because their voice box and such have been affected by the cancer. Is that a more extreme sort of treatment where you have to remove portions of the throat and such?
Yeah, for cancers in the other portions of the throat, the throat behind the mouth, which is the oropharynx, and the throat behind the voice box, surgery is also part of the treatment.
Okay.
Again, for every stage of the disease, there is a corresponding treatment.
Okay, so assuming you're worried, you had yourself tested, you've got the green light, you're okay. For people who want to make sure that they don't develop these types of diseases and cancers, what can they be doing? What sort of a lifestyle should they have? Are there any habits that they can adopt which lessen your risk? Obviously, avoiding tobacco and alcohol is there, but are there any other things you can be doing in terms of, I don't know, maybe getting more exercise, an environment that is more less conducive to the development of these things? What can people be doing to avoid getting sick?
It's mainly smoking and alcohol.
Okay. What about the environment that we live in? I mean, the air we have in certain environments is obviously not as clean as versus some areas where there's less pollution and that sort of thing. Carcinogens are in the air all over the place. Are there things that we can be doing to lessen our risk?
Environment pollution, it has not been proven yet. But there is one new thing now that has been discovered, which is the virus.
Okay.
Nasopharyngeal cancer is strongly related to a specific type of virus.
Okay.
The Epstein-Barr virus. We get that virus from common infections, and we don't know who's going to get the cancer. For the oropharyngeal cancer, it's another type of virus, the human papilloma virus. And again, you were asking about lifestyle.
Right.
Human papilloma virus is transmitted sexually.
Okay.
Especially oral sex.
All right. Well, that's the big three right there: smoking, drinking, and other lifestyle habits. All right. So throat cancer, it's a lot more common than we think it is, but it's not the end. If you do have it, it's easily treatable. The key really is early diagnosis and early treatment, isn't it? All right. So if you are worried about this condition, the first thing you should be doing is seeing Dr. Dan Alonzo, the Consultant Director of the Cancer Center at the Medical Cities. Thanks so much for joining us this morning, Doc.
Thank you.
Thank you.